Hello, I'm Natalia and I'm a specialist pelvic health physiotherapist. In this video, I want to give you very important recommendations when you're thinking about getting your pelvic floor, your bladder, your bowel or your sexual function better. And I'm also going to go through very common questions that I always get asked about pelvic floor and pelvic health. So the recommendations I want to give you are these. The first one is about reminders. The easiest way for you to get into the habit of doing your pelvic floor exercises is if you link those exercises to something that you already do. I would suggest, for example, that you do once a day your pelvic floor exercises right before you brush your teeth, and at that point you could be in a standing position. Then another time a day you could do the pelvic floor exercises when you're sitting right before you have your lunch. And then the third time could be as soon as you get into bed. So that way you know you have activities that you already do anyway, but you link the exercises to those, so then they become part of the daily routine. You can also use an app called Squeezy, which it sends you reminders for your pelvic floor exercises, or you could set alarms on your phone if you like to. The second recommendation I want to give you is about constipation. When you are constipated, there's no amount of pelvic floor exercises that can counteract the amount of straining that you will probably have to do to manage your constipation. So I really encourage you to really think of how to get your constipation improved. We should really be opening our bowels on a daily basis, and the stool consistency should be nice and easy to pass. So it might be that you have a look at your diet, so then you increase the amount of fiber that you're eating. It might be that you look at the amount of fluids that you're having, so then you drink at least 2 liters of water a day. But it also might be that you need to move more, because when we don't move and we because we can't, or because we just don't exercise, that can also lead to constipation. So I would like you to really think about that. Another recommendation is about weight management. There is only so much weight that those muscles down below can support. So keeping a good healthy weight is going to help with those symptoms of pelvic floor, bladder or bowel problems. Another recommendation is, if you have or have gone through perimenopause and you're into menopause and you have pelvic health symptoms such as urinary incontinence, fecal incontinence, prolapse, vaginal dryness, I think it's worth asking your GP for a prescription of topical estrogen and maybe use a vaginal moisturizer that can really make a difference, especially if you combine those things with your pelvic floor exercise routine. And one last recommendation would be that if you have practiced these exercises consistently for at least 3 months and you find that your symptoms of incontinence and your symptoms of pelvic floor weakness haven't improved, I will ask you to please request from your GP a referral to a women's health physiotherapist, or you can also self-refer to a pelvic health specialist using a website called Physio2U. That's PHYSIO2 and there you can find in your postcode a list of pelvic health specialists. Now, I would like to go through some questions that I get asked a lot. The first one is, do I have to do these exercises forever? And my answer to that is yes. But once your symptoms get better, you can get into just a maintenance routine where you do a few exercises of each of the ones that we went through in a separate video. So long exercises, quick exercises, and exercises with a cough a few times a day and maybe 3 times a week. But you should continue with the exercises because we age and those muscles get weaker as we do. Another question I get asked a lot is if you should do those exercises if you suffer with pelvic pain, if you suffer with something like interstitial cystitis or bladder pain syndrome, if you suffer with endometriosis or a condition called vulvodynia or vaginismus, which is painful sex. And my answer to that is maybe, because some of the exercises might help you, especially the breathing exercise that I taught you in the Introduction to Pelvic Floor Exercises video. But if you have any of those conditions, I will ask you to please find a specialist in pelvic health, because it's more likely that those muscles in response to pain are carrying a lot of tension and they need special treatment to get them to relax and reset, to then get them to be trained again. So please, if you do have any of those conditions, any pelvic pain, try to find a pelvic health specialist so they can help you for that individual case. Another question I get asked a lot is if those pelvic floor exercises are going to improve my sexual function. That is, if you have vaginal dryness, or if you have lack of orgasm and lack of arousal, and the answer is yes. Those exercises can improve all of those things. So I hope that really motivates you to start your pelvic floor exercise routine. Now finally, I would really like to encourage you to go back to see all the different videos that we've done, because in each of them I give you really important information. And every patient, or most patients that I see that have very complex pelvic health issues with bladder, bowel, sexual dysfunction, can improve if you are consistent, or if they are consistent with their pelvic floor routine. So please do your exercises, because they are really important and they're really going to help you with the problems that you're having. I hope you enjoyed these videos. I will see you again soon. Bye bye.